friends. This is the month of October, the Breast Cancer Awareness Month, and I am your expert. I'm going to give you some insights into this particular disease known as breast cancer. Well, breast cancer was a threat once upon a time, and it has stopped being so for a pretty long time with the advent of modern science and cancer treatments all over the world. Unfortunately, this has become a major global problem today, and in fact, even in India, it has crossed the number of cervical cancer cases amongst the female. So it is topping the list amongst female malignancies. Well, as I first said, that being from India, where everyday government aided or centrally sponsored screening programs are not available, being breast aware is the best way for our females to go about. Roughly, I would say the known risk factors of developing breast cancers are quite a few. The most important being the prolonged exposures to the female hormones, which means if you're having an early menarche, if you're having a late menopause, if you're having a late pregnancy, if you're breastfeeding your kid pretty late or never, then these are important risk factors. The other known risk factors are obesity, having high fat content in diet, low fiber and low fruits in your diet, and kind of breast related abnormalities in the form of cancer or even benign conditions. Now, beyond 40, what we expect is that you carry on your monthly breast self-examinations, and you get an annual mammography done, and almost every 3 years, preferably if it is done annually, you have to get yourself examined by a breast specialist or even a gynecologist who's perhaps experienced in dealing with breast cancers. Now, that's the easiest way and best possible way to prevent a breast cancer. But remember, even if it happens, the curability of breast cancer is very, very high. Even in stage 4 disease, which is presumably not curable, we can at least give a life of at least 5 to 7 years now with the advent of all modern techniques of treatment of cancer science. If we can get hold of it early, we can definitely cure it. Even in a locally advanced breast cancer setting, the cure rates are very, very high. And as I said, even if it is a stage 4 disease, we can actually give a life to a metastatic breast cancer or stage 4 breast cancer patient for at least 5 to 7 years now. So, to the ladies of India, it's our request that awareness is the most important factor, and bring self-aware of your problems, of your normal contours, and to find out whether you're having some kind of abnormality, and you being the first one to find out whether there is a problem and whether you need to visit a doctor is the best way to go ahead. Thank you.